Lecture 1.2 is going to go over anatomical terminology and directional terminology. So here we go. Medical terminology is something that obviously doctors, nurses are going to use, but as you take more anatomy classes, you will become familiar with that terminology as well. It's important to be able to understand this and use it when you are in those settings because you don't want any confusion or misnomers so that you understand what is being talked about, okay? For example, when I talk about my calf muscle, I typically call it my gastrocnemius because that is the proper name, the medical terminology for that muscle. Most people would commonly refer to those as your calf muscles. So it's important to be able to recognize that and identify that they're the same, both the vernacular, the common name, as well as the medical terminology. Oopsies. Next, we are going to talk about mostly surface anatomy, and we're going to go over a lot of regions and body planes and some directional terminology, as well as some body cavities. And most of that talks about surface anatomy, so anatomy that is near the surface or pretty close. And there's a couple of different organizational landmarks that we use in order to be able to identify and talk about them, right? The first is something called anatomical position. There's a famous drawing by Leonardo da Vinci. It's called the Vitruvian Man. Google it. And he's pretty much in anatomical position with some slight differences. But when you're in anatomical position, you are standing erect. So you're standing up straight, arms are at the sides, and your palms are facing forward or anterior, and feet are forward as well. We also use some descriptive terms, especially like in forensic science. They talk about positioning of the body. So in addition to anatomical position, when referencing body parts, we also talk about positions the body are in. Is the body supine or is it prone? So is the body lying down with the face up? So typically how you would lay down in your bed. Are you supine? Or are you prone? Are you lying down but with your face down? So again, some positional terminology to allow us to recognize where different body parts are located. The next few slides go through a lot of the regional terms, vocabulary that you should be working on already in your Quizlets or your flashcards, however it is that you are going to study. What I strongly recommend you do, there are some terms that are obvious. For example, the term for the face is the facial region. Nailed it. Or the term for the nose, the region where the nose is at, is the nasal region. Nailed it. Don't focus your time on those regions. The ones that are obvious and make sense are not where you should spend the time. You should spend the time on the name for the head, which is the cephalic region. Probably not something you're familiar with unless you know somebody that has had encephalitis and inflammation of the cephalic tissue. Or the chin, okay? The chin region is called the mental region. Or the axillary region, that's your armpit. So those types of regions that have names that are not as obvious and not as commonly used, you're going to want to create study tips and tricks and analogies and whatever else you can. So one of the tried and true tips that a lot of students have used in the past for axillary region is you spray Axe in your axillary region. So you use that Axe body spray in your axillary region, in your armpits to smell good. And that's a little trigger as a memory tool. So when you are making your vocab or making your Quizlet or making your flashcards, it would be smart to include some of those tips directly on there to help you word associate as you utilize these terms. Many of them you will become familiar with and they will make more sense as we learn more body systems. For example, your forehead, that region is referred to as the frontal region. Why? Because this bone that sits here is called the frontal bone. And beneath that, or deep to that, is the frontal lobe of your brain. The umbilical region, where your belly button sits, is where the umbilical cord would be located when you are in utero, all right? When you are a baby growing in a uterus, and then detached or cut away when you are born. So as you go through this terminology, and we're looking at the superior anterior terminology here, I'm going to go down to the inferior portion of the body. And again, you can see some terms that might be familiar to you, okay? The pelvic region, the pelvis, the pubic region, all right? Maybe the femoral region, the thigh region, because you know that the femur is a really big bone there. And then you have words like the pedal or the pedal region, all right? My analogy is I pedal with my pedals, all right? I pedal with my feet, all right? And that is the top surface of the foot. So make sure you take the time as you go through these individual terms and you are studying to create some study tips for yourself, right? Just a quick look at the posterior region as well. You have, the head region still here. The cervical region is the neck because of the cervical vertebra that sit there in the vertebral column. Although women do have a part of their reproductive anatomy referred to as the cervix. The cervical region is not located in the pubic region. It is located here. And then you have your inferior, posterior terminology, your lumbar, glutes, the popliteal region behind the knee, your sural region, which is the calf area where the gastrocnemius muscle is, calcaneal, which is your heel, again, calcaneal heel, and the plantar region. I have plantar fasciitis in my right foot right now, so I know that region really well. Not the greatest, but that reminds me I plant my foot. That's the sole of my foot, the part of my foot that goes down and steps down when I walk. In addition to those regional terms that you are going to spend time learning, you also need to be aware of some quadrants, especially in the abdominal region. Doctors use this a lot. There's a lot of anatomy that is located in the abdominal region. Hopefully, when we dissect our minks together in the spring, you'll be able to see there's a lot going on down there. And so when you're sick and you say, I have a tummy ache, it's very difficult to just know what's wrong because there's so many organs there. And so that's why doctors will poke around at your stomach. They'll do something called palpitation. They'll touch and push. And that palpitation helps them to identify which region, which quadrant of that abdominal region is causing you a problem. So doctors typically use 4 quadrants. And here is where we get into this idea of anatomical position, because when you look at a picture or a diagram or a model, you want to imagine that it's in anatomical position. So this person is standing in anatomical position, and you want to put your body on top of that so you know the right from the left. Because if I'm looking at my screen right now, this side is the left side of the screen, but it is the right side of the person's body. This side is the right side of my screen, but it is the left side of the person's body. Imagine if I were to turn my body around, here's my left hand. It's on that other side, as if I was laying on top of that diagram or that picture. So keep that in mind anytime you look, because there are a lot of things in anatomy that have a right and a left, and you want to make sure that you identify them properly. So here's your left side. The 4 quadrants are easy. Quad means 4. You have a left upper and a left lower. You have a right upper and a right lower. We'll look a little later at a picture that shows all of the anatomy that's underneath there, but this is relevant because if you have pain in that lower right quadrant, that could be a sign of appendicitis. That's where your appendix is. If you have pain in that upper right quadrant, that's primarily your liver, your gallbladder. So that could be an issue there, maybe the pancreas. Upper left, stomach, all right? And then you've got intestines kind of filled in all these areas as well, all right? So that's what a doctor would use. A doctor would refer to the 4 quadrants. If you were an anatomist, so someone who is studying the parts of the body, you're going to divide those quadrants into even smaller pieces, and they're going to be 9 different regions. The regions in the center have their own unique names. We'll start there, and then we'll look at the repetitive left and right portions. All right. In the center, there are 3 spots: epigastric, umbilical, and hypogastric or pubic region. This board or these regions kind of looks like tic-tac-toe. So I've had a lot of students in the past that have come up with like a tic-tac-toe game to be able to study these regions. I highly recommend creating something of that effect for you as a study tool. But you've got epi on top, you've got umbilical right where the belly button is, and you have hypogastric or pubic. All right. Hypogastric, so when your tummy rumbles, usually it's down pretty low. And so that's your hypo low, and then your epigastric epi up. Okay. Notice that on the left and right sides, you have the same name of the region, just a different direction, left or right. Okay. The 2 upper here in the corners of our tic-tac-toe spot is the left and the right hypochondriac region. My study tip for this is I always tend to think of someone who's a hypochondriac, someone who thinks that they have every single illness when they hear any symptom. And so someone who's a hypochondriac would be panicked. So they're up top with their hands. And so that's what I would say. I would remember the hypochondriac regions are going to be at the top. In the mid regions on either side, the left and the right, are the lumbar regions. Lumbar is that name for that lower back area, and that's where the lumbar vertebrae are located. And then all the way at the bottom two corners, the left and the right, are called the inguinal regions. Inguinal is your regional term for the groin. And the inguinal region goes kind of on this slope. And so that's what's located down at the bottom. Here's that picture I mentioned where it shows you the different anatomy inside of the different quadrants. And I'm going to have you focus on the blue line right now. The red line is our tic-tac-toe, and we're not going to focus too much on that. But if you look at the blue lines, you can see the separation, and you can see the main organs of the abdominal cavity. And like I said earlier, here's that liver, gallbladder, and pancreas on that right upper. Here is that appendix down here in the right lower. Good chunk of your appendix, your intestines down here on the lower left. And then you can see the stomach and the spleen located on the upper left corner. So again, doctors are palpating and using those quadrants to help narrow down when you say, I have a tummy ache, helping to figure out where exactly that is located. Lastly here, we're going to take a look at some directional terms. So as we move forward and we continue to dissect things, hopefully in person eventually, but as we continue to look at different models and images and pictures, we want to be able to talk about different body parts in reference to each other. And so we use some terminology to do that. We're going to look at this picture here that's located on the right of the screen here first and talk about the terms over here, and then we'll go back to the other side. Note, what we are looking at is, again, in anatomical position. So put yourself in the shoes, if you will, or lack thereof, of the picture and the model and the diagram, because that's going to help you. All right. With directional terms, you always study them in pairs. All right. They always come in pairs. If you have one word that means one thing, you have another that means the opposite. So you want to study them together, makes it easier. So first off, we have the anterior and the posterior. All right. Anterior means towards the front. Posterior means towards the back of the body. We use that terminology when talking about people, anterior, posterior. But you'll notice that there's also a secondary term for each of those locations, anterior or ventral, posterior or dorsal. Ventral refers to the ventral body cavity, which is the chest and the stomach here. So we have this ventral body cavity here, the belly side, if you will. And then we have the dorsal or the back side. Dorsal, you might remember if you have a aquatic animal that has a fin, it's typically a dorsal fin, like a dolphin. And then that ventral side is the belly. So we would use that terminology, ventral and dorsal, if we were talking about an animal. So when we look at our minks in May, we'll be talking about the ventral side versus the dorsal side. As opposed to on a human, we would talk anterior, posterior. That's your first set. Your second set of terminology has to do with top to bottom, okay? You'll notice here in the corner, you have superior and inferior. Superior means towards the top of the body, inferior towards the bottom. Another way to refer to that, and again, that superior, inferior terminology is what we use for people. Cranial and caudal is what we typically use for animals, because animals, most of them, are not bipedal like us on 2 feet. They're on 4, all right? And so we refer to towards the head, which would be the cranial, and then you have a caudal, which is towards the tail, all right? We don't have a tail, so we typically don't use that terminology with us. Our version of the tail is called the coccyx, aka the tailbone, which is a teeny tiny set of bones that is located at the caudal end or the inferior end of your vertebral column and your pelvis. So that's your second set of terms. All right, those are our first set of directional terms. Let's jump over here to take a look at our second diagram. And she is now facing us. She is in anatomical position. You can see her hands are facing forward, her palms, feet are pointing, and she's standing erect or straight up. All right, first set on this side, medial and lateral. All right, your midline of your body, pretty much, use your nose and your belly button. That gives you a pretty good gauge of where that midline is, and we would refer to that as the medial. Lateral would be anything away from that. Okay, so when we describe a body part as being medial, we mean it is close to the midline of the body. And when we describe a body part as lateral, that means it is located away from the midline. For example, my heart, which sits right here, I could say that the heart is medial to the shoulder, right? My heart is closer to my midline than my shoulder is. And vice versa. I could say my shoulder is lateral to my heart. And that's how we would use that set of terms. The next set is called proximal and distal. Proximal and distal terminology is only used for body parts, anatomy, that are located on an appendage. Those are your arms and your legs. So I could say that the head of my humerus, that's this bone in my arm, the head of the humerus, the end of the humerus, is proximal to my wrist, because the head of my humerus is closer to where my arm attaches to my trunk of my body than my wrist is. That's what I mean when I say proximal. It's closer to the trunk of my body. I could say the opposite. I could say my wrist is distal to the head of my humerus. My wrist is further away from the attachment point of my appendage to my trunk. And you could do the same on the leg, right? You could say your toes, your digits, are distal to your ankles, or you could say your ankles are proximal to your toes, right? Depending on if you were talking about something that is closer to or further away from where that appendage attaches to the trunk of the body, right? And that's your next set. Last set of terms are located down here on the box there. You can see superficial and deep. Superficial and deep, we use this for wounds, we use this for burns, we use this for layers of the skin. Superficial refers to anything close to the surface. Deep means obviously the opposite, further away from the surface. So in our first unit after this one, our first body system unit after this, we'll talk about the different layers of the skin and talk about who's superficial and who is deep.